work on is ensuring that we see the real benefits of technology improving the lives of children through both in improving their health and increasing access to social services. And that is why we play a significant role in the health information technology conversations and in technology in general. And so what I'm going to talk about briefly is I'm going to dovetail a little bit, echo a little bit of what some folks have already said about the benefits of telehealth, and then talk about future policy direction where we need to go. And what I think there's been a lot of great conversation and comments about the advantages of telehealth to meet the needs of children and adults with autism spectrum disorders. I want to just sort of echo the need of underserved children who live in rural and underserved areas in the urban areas of California. Low-income children live. They face geographic and economic barriers to accessing care. One of the barriers that I think is that we're talking about here is specialists. A lot of specialists, pediatric subspecialists, reside and practice in urban areas, and that makes a lot of sense. We don't need a pediatric cardiologist in a rural area when there's only one or two patients there. So telehealth really helps those families get the care that they need. Back to the need, underserved families have more difficulty accessing care. Transportation costs, the cost of missing school and work. Low-income workers often miss pay when they miss work. Some of us who are salaried have sick leave. A lot of low-income workers don't, and their children and families suffer, and they can't afford the transportation. And so being able to bring care to where they are makes a lot of sense. The other thing I want to emphasize is the benefits of telehealth. Earlier in this hearing, we heard about the comorbidities that children with autism spectrum disorders oftentimes have behavioral health issues, have gastrointestinal issues. They may have neurological issues. We heard about seizures. Those pediatric subspecialists, again, are in urban areas often, and we need access to those providers. And because these children are receiving so many services, that the benefits of being able to stay in their community and stay where they are is that's just an additional benefit, because they won't have to travel as much. If a child has to see 4 or 5 doctors a month, to have to travel to that is quite a burden for that family. And then the last thing I wanted to say about that was because children with autism spectrum disorders have issues around, it makes more sense for a number of reasons for these children to stay where they are. They have some issues with transition to different areas, to being transported to the doctor. There was a program that's no longer running in Akron, Ohio, that worked in schools that served children with developmental disabilities. A lot of these children had autism spectrum disorders and other developmental disabilities, and they used telehealth for the acute care. So when a child had a cold, or when a child had a sore throat or an ear infection, that this saved this child from the transportation. Many of these kids needed an aid, so having an aid transport with this child, so keeping the child where they are in the school. So again, my point was really just to kind of dovetail on what other folks were saying about telehealth and the benefits. What I want to conclude with is where we need to go policy-wise. In 1996, we had the Telemedicine Development Act of 1996, and that was a huge seminal piece of legislation that led the nation in telemedicine. Then AB 415 this year was enacted, and that's just another step in where California can be a leader. There are a few more things we can do to make California a leader in telehealth and making sure that Californians get the care they need using the advances of technology. this is sort of a difficult one to say, but we do need money, and and it's hard to say, especially right now when budget negotiations are happening. But what AB 415 did was allowed for so many things to happen, changed policy so that we had the platform for using telehealth for various modalities. But those modalities need to be paid for. Right now, Medi-Cal pays for video conferencing for a patient and a provider to meet via video conferencing. It also pays for 3 store and forward applications where data are collected in one site and reviewed later for diagnosis and or for evaluation and treatment recommendations. It's teleoptometry, teleophthalmology, and dermatology. However, it's been clinically proven that other forms of store and forward are clinically proven to improve care. Teledentistry, telecardiology. Therefore, so with the change in the terminology from telemedicine to telehealth, we need to have the finances follow that. And so we need reimbursement for all store and forward applications. We also need to, and this is probably a longer conversation, but we also really need to look at how we're transforming our healthcare system using technology and start to pay for outcomes rather than for individual services. And let's say it makes sense to use email and it makes sense to do a teledermatology visit. Let's look at not just paying for how those services are provided, but let's look at outcomes using those technologies so that we're not constantly looking to pay for certain services, but we're looking for overall health. And I think that we can reduce costs in the long run. Finally, and this has been emphasized already a lot in this hearing, is we really need to invest in pilots and really need to demonstrate how telehealth can improve the lives of children and adults with autism spectrum disorders. We really need to use public-private partnerships to do that. I think Senator Alquist and Senator Steinberg's legislation, SB 764 and SB 1040, are great first steps, and I think we should all be supportive so that we can demonstrate how these work to improve the lives of Californians in cost-effective ways.
Thank you. I have a number of questions, if you don't mind. I couldn't help but think of Mr. Perez, who was up here just before you, and said, the ability to hook up at the beginning, that's sort of the complicated part.
Yeah.
But I was thinking, he's so talented in high tech. What if the poor person that you described doesn't have, one, that ability, and second, doesn't have the machinery?
Yeah.
I think of myself. I still can't Skype, and I think the reason for that is because I have old technology. My daughter has the newest stuff, and she just pushes a button. It seems like it all happens.
So it's a huge issue. This is a very complicated, complex issue, and another area that the Children's Partnership focuses on is increasing access to technology for underserved communities. And an initiative that we started, that we spearheaded a few years ago and has sort of spun off into itself, is we have a project called School to Home, whose ultimate goal is to
Sorry, what's it called again?
It's called School to Home.
I'm sorry.
And if you want to look it up, it's school with the number 2 and home. And the goal of that project is to ensure that all children and families who attend underperforming middle schools go home with a computing device and the skills to use them, as well as access to broadband, affordable access to broadband. So the program is being beta tested in a middle school in Los Angeles and in a middle school in Riverside County, and we can talk a little bit more about that later if we would love to talk more about that. So the point is you raise a huge issue. It's not totally resolved. I think Mario can talk about some of the resources.
Well, we do have in California the largest single grant in the country for the creation of the technical support and access to broadband with the California Telehealth Network, and receiving funds from the FCC to be able to provide subsidized access to high-speed broadband for all kinds of healthcare facilities and health systems. In addition, we also received a grant from the federal government for improving, it's called BTOP grant, which is about the sustainability of broadband and other applications beyond just the usual forms of it, to think real creatively as to how we can make broadband access to people in all over the state. And we have 15 demonstration projects that are in place that are pilots that we're providing technical assistance and support to people on the ground, grassroots support that hopefully will be taken to scale.
I guess, and I would follow up with this question though. As you were explaining this, I thought, in the case of my own family where we didn't speak at home, we spoke Spanish and my parents didn't speak English. We were the translators. We were the ones that were able to take the information, whether it was medical information, dental information, and translate it to them so they could understand it in Spanish growing up. Now, in the case of autism spectrum disorder, a family that's challenged with language, in that context, how would you bring that information to that family?
So I think the great thing about your questions is that with technology, we can use our imagination and probably identify a solution for everything. So the use of technology for translation services is widely used and and it's actually very cost effective. So let me give you an example of a hospital-based system, and then we can probably translate that to like a home-based. But it used to be, well, and it still is, that if there was a non-English speaking patient, an in-person translator would go to that doctor's appointment with them. It's oftentimes families do it and children do that, which is not the best use of children. It's fairly inappropriate. Now you can actually pool translators in one room right here, and we could be doing translation to hospitals all over the country. And you could do that either by phone, video phone, or telephone, or you could do that by video conferencing. Oftentimes video conferencing is better because you can help with that cultural piece and the cultural sensitivity piece. So you can bring that kind of service to a home-based service. There's also other programs that do translation.
Well, I was going to also mention that using imagination and the advantage of the technology allows us to really eliminate the border as a barrier. And the University of California's the School of Medicine has now entered into a partnership with the state of Sinaloa, Mexico, to look at issues around research around telehealth and healthcare delivery systems, so that we're really bringing the communities closer together. And where you have psychiatrists and psychologists and specialists in Mexico who would be available to provide that consultation through the telehealth technology. So that's just one area where we can really bring our families closer together.
Good point. Thank you. Okay, seeing no more questions, thank you very much for your comments and the information you provided today. Appreciate it.
Great, thank you.
Okay.
Thank you.
Yes, of course. Before you go, we do have some comments.
Thank you again. I think it's a very compelling testimony. And Senator, your questions were very insightful. Yeah. I've been working in the area of autism for about 16, 17 years. It just occurred to me that I have never encountered a situation where the Promotora model has been used in the evaluation and treatment of autism, and yet we know it's very effective in many communities. I think that from the comments and the discussion, it would be a great opportunity to using technology to integrate the Promotora model with technology, with the curriculum and training, that could be implemented, and to, again, overcome those barriers and provide that access to underserved communities.
Good point.
If I may, also, that we have seen the promotoras in traditional healthcare systems in rural farm working communities with PDAs being able to go out into the fields and provide that service and bring that technology right to the family and to the community. So it's already happening in that aspect. And
the one thing about telehealth is that we have to remember it's not just the patient connecting to a provider far away. It's it's the primary care provider or somebody who, or a teacher or a school psychologist who is there with the patient, who the patient is comfortable with, connecting to somewhere outside. So that's a great role for a promotora.
Thank you.
Thank you.
Thank you very much. Thank you very much. Appreciate it. Okay. We're going to go now to the next section, which is public comment. I know that some people have already signed up to speak. I'm going to call your name. Please feel free to come up and give your testimony. If I mispronounce your name, I apologize. Connie Lappin? Connie.
Yes.
I apologize. Connie Lappin and Lisa Brighton. If anyone else would like to speak after that, we'd be happy to hear from you. Go ahead and start to give your name and give your testimony.
My name is Connie Lappin, and I want to thank you so much for having this hearing and giving attention and power to a potentially innovative solution that can help in these challenging times. I know the word we're not supposed to ever use in this room anymore is money, and that's what makes it so challenging. As I said, my name is Connie Lappin. I'm the mother of a son with severe autism, and he next month will be 44. So I don't call myself the older parent anymore. I call myself now a historian. But I want to say that we were here, our family was here before there was any mandated services, and actually autism was legally excluded. So why am I here? Why am I still here? Because our family experienced the birth and the growth of a system that met the needs of people with autism. And now, unfortunately, because of the economy and the fiscal restraints, I'm seeing all our service delivery systems become extremely fragile and fiscally challenged. So I want a solution that makes sense and improve the needs of our children, and like other people have said, with positive outcomes and not forgetting the human touch. I love this hearing because they said it so, a lot of the speakers said it so eloquently about the complexity of autism. There is no cure, but absolute great success can happen with early intervention and positive treatment. I love the idea that we talked about the comorbidity of the disease or the symptom or the syndrome, because the medical issues are very often left on the side. And a lot of us in the autism world say if you've met one person with autism, you've met one person with autism. Very unique disability. And thank you so much. I've never heard so much at a hearing like this talking about the underserved. It needs to be talked about, language problems and ethnic minorities and lots of stuff. I want a solution, and I think that that I see potential here, and I want to thank all of you, and especially Senator Steinberg, for putting autism out there when things are rough. The Blue Ribbon Commission, the task force, we even had a housing bill, and then, my God, the celebration for the autism insurance. I wanted my son to become young again. I mean, I figure out how to do that. So I'm the optimist, and we know that Apple was successful in a downturn, so why can't we be the next Apple? So I want to tell you all, and everybody in this room, carpe diem, seize the day, and I hope I last long enough to be here next year and the years after and say, look what we did. So thank you very much.
Thank you. Thank you for being here. Appreciate it. Okay, we're going to go to the next person. Go ahead and give your name and testimony. Welcome to you.
My name is Dr. Lisa Britton, and I'm the Vice President of Clinical Services and Integrity Assurance for Spectrum Center Schools. We provide educational services for students with autism. And state superintendents and member of the Senate Select Committee have toured our sites previously. We've had the opportunity to utilize telehealth systems to improve the quality of our services and to provide training to our staff with great success. There is some research out there that indicates that telehealth systems can be used to provide quality services to children and training to parents. This research is coming out of the University of Iowa, and they've shown great success and with a reduction in costs for those services compared to in-person services. Our students at Spectrum Center sponsored a bill that became law that calls for more technology in the classrooms. And we and our students feel like it needs to be greater dialogue in this area. And because of this, we're really thankful for Senator Steinberg in really taking leadership on this issue. Thank you.
Hello, my name's Lynn Frampton. I'm a medical case manager for a large agency here in Sacramento that provides support to adults with developmentally disabilities, and autism is in that category. We provide supported living services, ILS services, VOC services. We want you to know that the crossroads of technology and health services, it's already happening. You're way behind. It's already happening. It's going to continue to happen. It's going to expand regardless of the committee's paradigm. And it's driven by how ethical it is and how pragmatic it is. The agency that I work for supports a lot of people with developmental disabilities that are also deaf. And the deaf are on the technology curve way ahead of the rest of us hearing folks. They have every gadget and they know exactly how to use it. They have video relay in their homes. And my staff and my patients have provided me with this, where it goes everywhere that I go. It's just an iPad too. And I can talk to them in their homes on the video relay. I can do triage out in the field. Somebody can call me and ask me, should we go to ER? Should we just make an appointment with a doctor? They can send me pictures of things. They can take vitals for me. I can keep people out of the emergency room, which is when you don't know what to do. That's kind of where people tend to pile up. That's just going to continue to happen. And like I said, it happens because it's pragmatic. If you work with somebody, if you know anybody with autism, they like their schedules and routines maintained. They don't like going to the doctor's office or the really noisy, smelly ER. They're not really cooperative with things that are out of the ordinary for them. And so this is a way for them to talk to me. They like two-dimensional communication better than three-dimensional, and it just works on a lot of aspects. One of the things that I urge the committee to consider, this is going to continue to grow and expand. Let's use what we have already. Let's use the internet. Let's use the iPad. It's $600. If I wanted to buy an augmented communication device from Dynavox for somebody, it's $15,000, and it's going to be a dinosaur in 5 years. If this breaks down, I go to the Apple store and I tell them to fix it. If there's a new app, they load it up. Let's just be really pragmatic about this. Let's not create a whole boutique communication system. Let's use what we already have. Thank you.
Thank you very much. Please.
Thank you. Jim Lantry with the DIR Floor Time Coalition of California. And Senator Steinberg, I know you didn't want any more praise for what you did last year, but all I've got to say is wow. And I'm not talking about last year because this hearing has been great. The idea of using technology for remote treatment and assessments is amazing. In San Diego, the San Diego Regional Center has done some experiments, particularly with going out into Imperial Valley, into Senator Vargas's district, where we just can't get people to, trained people out there to service the need. It is a very real need throughout the eastern portion of the state, and I applaud you for what you're trying to do. One thing I will add is that, as it was said before by Connie Lapin, one child with autism is just one child with autism. We need to expand this to all the evidence-based practices, and I believe that's what we're doing. If you look at floor time, there are experiments going through right now about delivering some services remotely, particularly assessment and parent training. I think RDI is the same. ABA is also doing it. I think that all in all, we are forming a delivery model that is going to be much more cost effective, and I applaud this committee for exploring this, and we stand ready to help in any way we can. Thank you.
Thank you so much for testifying. We appreciate it. Is there any other public testimony? That's it. Senator Vargas, any thoughts, closing comments?
Yes. First of all, again, praise you. Thank you again for putting on this hearing. I appreciate it in the work we did last year. One of the things that did come out in the testimony to me, and I appreciate the speaker, one of the speakers at the end that noticed this, was the underserved and people with language issues, and how do we reach those individuals and their families. And I think that is a great need. And again, I appreciate that it was brought up here today, and see how we can work together to help those people, and I think in particular we want to make sure that everyone is helped, but that no one's left behind. And it seems like they might be some of the more difficult people to help because of language issues and poverty and some of their living arrangements where they are in rural or hard to reach areas. So I appreciate that very much. Thank you. Thank you.
Well, thank you very much. So I appreciate your being here today and your interest on the issue. I also want to thank the other members as well as Liz Mara again for putting together a very thorough hearing. The advocates and the members of the public. Just the attendance here today, both in the audience and among the membership for a informational hearing, I think speaks volumes about the levels of interest here. And so again, I put out this challenge. How do we take what we heard today and translate it into public policy that helps further these opportunities to use technology appropriately to serve more children and more families? There are certainly some research imperatives here, I think, that we heard about today. And there is some marketing and communication imperatives when it comes to some basic research like the impact on vitamins on reducing incidence of autism. And then how do we take the best practices here and how do we make sure that we use our existing funding to expand them? So I'm looking forward to the rest of the year. I don't know that we can and will replicate 946 this year, but certainly there's a lot of work to do. I know we have a hearing again in March, if I'm not mistaken, March the 28th, where we're going to look at the issues of diversity and equity when it comes to the workforce and also when it comes to the providing of the services themselves. So let's just keep going here, all right, until we have achieved our big goals here, which is to make this disorder a top-tier public health priority, to have the funding, the attention that it needs and deserves, and make sure that every family has what they need to help their child. That's what it's about. So thank you. Nothing further to come before the committee. We'll be adjourned.